Hi everyone again. So today we are going to look at coagulation, and we are going to look at a situation where there is raised INR, or what people could call prolonged INR. So if there is a prolonged INR, what does that mean? Remember what I said in my previous video, that for you to increase your chances of getting a job as a biomedical scientist, you need to know why. So why would INR be raised? Okay, I think we are better off to start off with knowing that INR, there is basically known as International Normalized Ratio. And one other things I want to say there is for you to know that INR is derived. So we don't necessarily measure INR. We measure PT, Prothrombin Time. So from the result we get from the Prothrombin Time, then we can derive INR. And that's why INR is called International Normalized Ratio. So the question now is, what does Prothrombin Time measure? Now I would like to take us a little bit backward about knowing our coagulation pathway. So we have intrinsic pathway, we have extrinsic pathway, then we have common pathway. Okay, so as overview, sometimes there could be abnormality from the intrinsic pathway, or from the extrinsic pathway, or from the common pathway. So once there's any of this abnormality, that can have effect on the overall result. So for example, if there's a problem from the intrinsic pathway, okay, you will find that there is going to be a delay. There will be that will affect the result, okay, because maybe a particular factor from the intrinsic fat pathway is deficient, or as the case may be. The same thing is also applicable in intrinsic pathway, okay? Now, but if there's effect in the common pathway, even though, because common pathway is an intercept, is where both the intrinsic and extrinsic meet, okay? So if there's a problem in the common pathway, it doesn't matter how effective the intrinsic or extrinsic pathway is, that result will still be prolonged because the problem is coming from the common pathway. Anyway, we're going to discuss this in details, as I make, future videos. But for now, I want to concentrate on the raised INR. And like I've said, INR is obtained from the PT. So what is PT? Prothrombin Time. So what does PT really measure? So I want you to know that PT, Prothrombin Time, measures extrinsic pathway. Okay, so it's also your duty to find out some clotting factors that can be found in the extrinsic pathway. Okay, so this PT measures extrinsic pathway. So because it measures extrinsic pathway, it can help you to determine whether the prolonged PT-INR, as we call it here. So we use the word PT-INR because the INR is obtained from the PT. Okay, so if the PT-INR is prolonged, maybe there are a few things that can cause that. So maybe there's a factor that is deficient, or maybe there is something affecting the factors and making them not to function very well. And if that is the case, that will make the PT and INR to be raised, because PT-INR measures extrinsic factor. So if it is prolonged, maybe it's a problem from the extrinsic factor. But don't forget what I said as well, that common pathway can affect both intrinsic and extrinsic pathway. Therefore, if PT-INR is raised, it could also be as a result of common pathway problem. So let's go into normal biomedical scientist question. So if the PT-INR is raised, what does it mean? So like I've said, it means that maybe there is a factor deficiency, or maybe there is something like inhibitors affecting the clotting factors in the extrinsic pathway, because PT measures extrinsic pathway. Now, but sometimes it is not the problem from any of them. It could be due to sample integrity. For an example, if the sample is clotted, that clotted sample will lead to prolonged PT-INR. Why? because the fact the sample is already clotted. The clotting factor that could have been used to clot the samples in the analyzer had already been activated. So that can lead to the prolonged PT-INR. So clotted sample can be one of the reasons why PT-INR is raised. Okay? But beyond that clotting, the sample being clotted, in most cases is not sample clotted. It could be because of maybe the patient is on an anticoagulant such as Warfarin. Okay, if that is the case, that Warfarin affects the clotting factors in the extrinsic pathway, and that can lead to the prolonged PT-INR. So if the PT-INR is raised, one, it can be due to clotted sample. So you check the sample, it is not clotted. The next thing you then need to do is to ask yourself, is the patient on any anticoagulant? If the patient is on anticoagulant such as Warfarin, that explains that, because Warfarin affects extrinsic factors. Okay, so because it has that effect, okay, that can now lead to that prolonged PT-INR. So that will explain the result. But there's also another situation whereby the person is not on anticoagulant, the person is not on any anticoagulant such as Warfarin, and the sample is not clotted, but that result is still prolonged. In that situation, you then need to ask yourself some questions. What are the other factors that could cause raised PT-INR? And that is where you need to start thinking, maybe it's a factor deficiency, or maybe it is an inhibitor. Okay, this is very important. So it could be either factor deficiency or maybe it's an inhibitor. Do you get? Now, how can you do? What is the further test you can do to be able to determine whether it is a factor deficiency or whether it is an inhibitor? Okay, so you now do what we call mixing study. So mixing study in terms of PT-INR is called PT50. Okay, meaning 50% of the patient sample plus 50% of your control sample, okay, or non-sample. So when you mix them together, then you can repeat the PT-INR. When you repeat it, if the result becomes normal, that means there is factor deficiency. Why? Because it means that your control sample has compensated the factor deficiency in the patient sample. However, sometimes when you do it, you still find out that it is still raised, it is still prolonged, but you are very sure that you use a control sample. What that means then is that there is something from the patient sample that possibly affected the control sample as well, and that could be an inhibitor. Okay, so when you do that, if you do a mixing study and it corrects, meaning it becomes normal, then you can say it's a factor deficiency. And what are you going to do when you realize it is a factor deficiency? You do a further test, extrinsic factor assay. So you can do extrinsic factor assay to determine which particular factor is deficient. You see, that's very important. And again, if you do it and it did not correct, it is still prolonged, then you now start thinking in terms of maybe it's an inhibitor. And that is where special coagulation tests such as lupus anticoagulant can be done, okay, to determine whether or not is an inhibitor from the patient sample. So you see, prolonged PT-INR could be due to 1, the sample is clotted; 2, maybe the patient is on anticoagulant such as Warfarin, but whereby the patient is not on anticoagulant such as Warfarin, it could then be due to factor deficiency or it could be an inhibitor. So how can you find out? You do a mixing study. And when you do a mixing study, if it corrects from what I've told you earlier on, it means it's a factor deficiency. If it does not correct, it then means that it's an inhibitor. You see it now. And then if it corrects and you think it's a factor deficiency, you have to do a factor assay. If it does not correct and you think it's an inhibitor, then you then have to do a special coagulation test such as lupus anticoagulant test. You see, these are the details they expect from you. There are more details, but I'll try to focus on maybe the kind of things the system would like to hear from you. So if you go for an interview, they ask you, in a situation whereby there's a raised PT-INR, what are you going to do, or what does that indicate? You need to make sure you tell them these stories the same way I've said it. You said you are going to check the sample for clot. If the sample is not clotted or it is not even underfilled, as the case may be, then you now need to check whether the patient is on anticoagulant. If the patient is on anticoagulant, it explains the result. But if the patient is not an anticoagulant, then you need to go further to do a mixing study to determine whether it's a factor deficiency or it's an inhibitor. Okay, so how can you do that mixing study? You get a 50% of the patient sample, 50% of the control, you mix it together. That's why it's called a mixing study. Then, if it's correct, meaning if the result becomes normal, then you say it's a factor deficiency. If the result is still prolonged, you can suspect an inhibitor. And then you follow the whole process I've said in terms of either doing a further factor assay like extrinsic factor assay or lupus anticoagulant. That is a detail that the system want to hear when they ask you about what are you going to do about in a situation where you get a result of high or raised or prolonged PT-INR. Now let us link a little bit more detail you can give to them. So a situation whereby you now think is a factor deficiency because you've done a mixing study and you now think it's a factor deficiency. So what do you think that can be done before you even do the factor assay? That is why doctors can then prescribe fresh frozen plasma. I will discuss that in detail when we get to blood transfusion. But that fresh frozen plasma is rich in clotting factors, and that is why they can prescribe that while waiting for the factor assays to be done. So these are the vital information that you need to give to them. So anytime you go for an interview, they ask you, what does high or raised PT-INR means? This is your answer. Okay? Then another thing you have to also think about this is that sometimes it's okay, if the PT-INR is raised, what are you going to do? One of the things you are going to do is that after you investigated, the person is on warfarin or anticoagulant. Once the person, your investigation, you've done, check your clot, it is not clotted, check the person is on anticoagulant, you really need to do something, depending on how high the PT-INR is. For example, if the PT-INR is 5.0, okay, you need to ask yourself, what does that mean to the patient? It means that the amount of the warfarin, because PT-INR measures the dosage of warfarin. So PT-INR or INR measure the dosage of warfarin. So the higher the PT-INR, the higher the warfarin in the person's system. And remember that warfarin is an anticoagulant. So what that means that it makes the patient system, that blood, to become too watery. Okay, so when the INR is 5.0, it is an urgent result. You need to phone it, because the doctor will then need to review the dosage they are giving to the patient, because if they continue like that, the patient may start bleeding from the nose, from the mouth, and that can be a serious situation. Okay, so that is why you phone that result, because PT or INR measure the dosage of warfarin, the anticoagulant, in the patient system. You see, that is why it's very, very vital. Another aspect of this question in your interview is that they will say a patient was rushed to A&E, and the patient was bleeding from the nose, from the mouth. What do you think has happened? What has happened is that it's possible that the amount of the anticoagulant in the patient system, okay, is not high, making the blood to be watery, and that's why the person was bleeding from the nose, from the mouth. So this is just the few things at time can allow me to accommodate in terms of raised PT-INR. Just think about the answers I've given you about raised PT-INR. I can bet you many people don't give this detail, but once you give this detail, you have now the whole answer, and nobody will refuse you any mark if you give this detailed answer. And that is the kind of thing expected, from you as a biomedical scientist. And these are the kind of answers you need to give, okay, to be able to increase your chances of getting a job as a biomedical scientist, especially here in the UK. So I'm going to continue to make more videos, like I've said. Maybe next time I'm going to look at intrinsic factors or pathways like APTT and so on. Thank you so much for listening, and look forward for the next videos, like I've said. And please do subscribe so that once I upload the video, you can be able to see it. In the end, all I want to achieve with the videos that I'm making is to give people the opportunity to access these videos and prepare for their interviews. And hopefully, I hope that this will, in the end, help each one of you to get the job, your dream job of working in the UK as a biomedical scientist. Thank you so much. Till I come back to your way again.